So I'm very grateful to have the chance to be here again, and especially pleased to have the chance to be here with you to help launch the network of Chief Clinical Information Officers. I can applaud the progress of the campaign. I think it's a very important thing for us to be doing. It's great to see growing recognition of how clinicians can innovate with imagination and creativity. And as we increasingly harness the power of information, I can see that clinical leadership will use information to transform patient care in the NHS. I've always been committed to putting doctors, nurses and other clinicians in charge, freed from the burden of bureaucracy and from top-down micromanagement, freed to focus on the best interests and how you can achieve the best outcomes for your patients. Now, I know the NHS boasts a wealth of world-beating talent, ideas and new thinking. And the idea that you would not let them lead and innovate and be creative and enterprising is absurd, because there is so much potential untapped. The challenge in this context is to exploit all that, to ensure that excellence is no longer the exception, but it is celebrated and diffused across the health service so that excellence becomes the norm. So I'm going to say something that you would not normally expect me to say. I am here from the Department of Health, and we are here to help you.
So, in my opinion, I'm a CCIO in any other name, but I don't have information in my portfolio at the moment, thank goodness. But I kind of see myself in a sort of a circular role. So my job is to make sure that we give people the gizmos and the gadgets and the processors to be able to capture the information that they need. So if they need to capture people's inside leg measurement, we have a gizmo that does that. But my job is about focusing on cultural change and how IT can help. It would be unthinkable to go into a bank nowadays and to have paper ledgers with all of those things, and yet we accept the fact that patients come to see us and we sit in front of them with paper case notes. That has to stop, and that's why I'm so passionate about making sure that we use IT to the best ability that we can do.
The person who does it needs to have a deep understanding of the organisation and of the system that you're proposing to deploy. These are the statements from chief executives. And they must act as very, very good interpreters between clinician and technician. They need to be able to strategize, they need to be inspirational, they need to be able to explain things in all sorts of different ways to different people. They need to be able to talk to not just clinicians, but also the administrative staff to make them feel part of a big clinical process.
Just to summarise, we see, firstly, it's to ensure that individual patient data is complete, accurate and available to those who need it. Secondly, the role is important to support safe, efficient care and shared decision-making between professionals and patients. And thirdly, it's important to ensure that the aggregate information that is derived from the delivery of healthcare is relevant, valid and useful to patients, professionals and the NHS itself as an organisation.
It's had a great start. It just needs to build on that success, really. I think it's important that the network develops in two ways. I think it needs to be enabled by the website and information technology. Of course, is one of the issues of the scheme as well, but also to build that support in a physical capacity across the country so that people can understand what CCIOs are trying to achieve and inform and educate their employers.
I'm very excited by the Leaders Network. I think it's a fantastic opportunity for us to grow some informatics leaders from across the professions to fill the gap that we're going to have for the future. Informatics is definitely going to have a big role for the way we deliver health services in the future, and we need to think creatively about how we can grow people and enthuse people to take up the leadership challenge around informatics.
Well, I think it's great to get such high-level political backing. I mean, I think that was about as clear a signal as you could possibly get from a Secretary of State that CCIOs are the right thing to do, and that he expects the NHS to be following the lead of the early adopters. So I think that was superb. It's also just really great and inspiring to hear from some of the early clinical leaders in information, hear what they're doing, and hear actually about the practical benefits that it's bringing on the ground. I mean, I think very often we've been in a situation where information and IT has dominated clinicians and expected clinicians to serve it, when actually it should be exactly the other way around. The information and the IT is there to serve clinicians, to help them deliver better outcomes for patients, and clearly the CCIO is a really, really important part of that process.
I'm absolutely thrilled with this. This is something that we've been waiting for to happen for ages. I've been National Clinical Lead for Midwifery, Connecting for Health, Department of Health Informatics Directorate for 4 years now. My tenure is just coming to an end at the end of March. And we've wanted to have a broader network of clinical leaders and clinical influencers, not just for what's considered informatics and IT and tech, but how information is used for care, what difference it makes for patients and what difference it makes for nurses, midwives, doctors, allied healthcare professionals doing their care every day. It's absolutely across the board, and it's vital that we get a network like this going.